When we see that the patient's head is not in the middle of the shoulders, but a little bit to the side, then we see in this frontal plane that the distance between the neck and the shoulder on the left side is short, and on the right side this distance is long. This means that the mediastinum is not exactly in the middle of the thorax. And that indicates that the lungs on the left side cannot expand sufficiently. That means that we have to bring the mediastinum back to the middle of the thorax. This situation is an indication for a translational lesion of the upper thoracics to the right. When the upper thoracics shift to the right, then we see this type of position. I'll show you the corrective technique in a minute. As shown in the first part, we had an upper thoracic shift lesion to the right. That means that we have to push this upper thoracic vertebra towards the left. The aim is not only to correct the vertebral lesion, but also to bring the mediastinum in the middle of the thorax so that both lungs can expand in a similar way. So I have to manipulate the vertebra towards the left. Therefore, I cross the arms of the patient like this, and I take a contact with the vertebra in lesion. I hook behind the spinal process. The head of the patient is in a neutral position, and my thrust is going to be like this, in this direction. Can you do an inhalation? And you exhale very gently. I'm going to the barrier of motion, and I do a shift towards the left. I can then see that the head of the patient again is in the middle of the shoulders.